And we're back with Advancing Healthcare Transformation with Health IT, sponsored by HIMSS on Federal News Radio, 1500 AM. I'm Tom Leary with HIMSS, and I'm joined by Roger Baker, former Assistant Secretary of Veterans Affairs and current Chief Strategy Officer at Agilix, and Anish Chopra, former Chief Technology Officer of the United States and author of the new book, Innovative State: How New Technologies Can Transform Government. We've been talking about the role of health IT policy in transforming healthcare. I'd like to move on to consumer engagement and then have some big thoughts towards the end of the discussion. Making patients partners in their own care is an absolutely critical discussion that we're hearing all throughout Washington and around the country these days. Anish, why is consumer engagement in healthcare so important, and what role do you see the consumer and mobile technologies playing?
Well, to state the obvious, the patient has the most at stake in getting healthier. And so equipping them and arming them with the information they need to live safer, healthier lives, it's just the right thing to do. But there's another reason. I actually believe the patient can actually help us bring about the future of interoperability in a manner that lowers the complexity and maximizes their privacy and security. You know, we have had a debate in this country that when two organizations aren't technically affiliated with each other, what right do they have to share health information on behalf of a patient that they happen to have in common? And today, under our privacy statutes, the reality is not much unless the patient explicitly offers that permission. And so, in many ways, a big reason why we don't have open pipes connecting doctors and hospitals and pharmacies is in part because each organization is responsible for protecting the security of that data and making sure that their private relationship with their patient is honored. So we're in this quandary. We want to be able to share data across boundaries. We think it's in the best interests of the patients that we serve, but we sort of can't do that unless they're part of the conversation. So what's the good news? The reason why we spoke of the blue button movement in many ways is that it really ushers in a lot of the capabilities that we're seeing on the internet economy more generally about how patients can take a more active role, not in signing 9 pages of authorized consent about all the different people that want rights to my data, but to have almost in real time the ability to regulate effectively the use of their data in ways that they deem appropriate. I was motivated when I was thinking about open innovation principles and how to connect databases that don't normally talk to each other, motivated by what I was seeing on the consumer end outside of healthcare. I'll admit that I'm a Netflix customer, and I have made the choice to view a lot of my Netflix content on my Apple TV. Two organizations that don't have the right to look at my private, sensitive rental records unless I'm explicitly involved in that discussion. Well, the user experience is phenomenally simple. I visit Apple TV, I inform them of my username and password to Netflix. Netflix then text messages me and asks me to send in an authorizing code that I really mean for Apple TV to see my very sensitive rental records history. And I've approved the use of my data so that I can get a better experience. Or to take it a little bit more awkwardly in healthcare, the New York Times recently ran a story that a gym called Equinox in New York makes it, following the exact same principles, remarkably easy for one of their gym customers to share their wearable data, their Fitbit data, their Jawbone data with their instructor. Again, with the consumer authorizing the use of the sharing of that data because they want their trainer to make sure that they're on their regimen. Why is it so difficult for us in healthcare to make it just as easy to engage the patient in authorizing the use of their data for purposes of improving their health? You know, I'm shocked when I visit the accountable care organizations who, by the way, find that 66% of the care that's delivered on specialty services occur outside of the ACO network that they've built. Mm-hmm. they feel like they're entitled to the data on that patient outside of the network, but technically speaking, for privacy purposes, they are not, unless they actively ask the patient's permission. If the fitness instructor has found a way to ask the patient or the consumer, if I can share your sensitive fitness data, surely ACOs can find a way to ask patients if they're willing to share their out-of-network data. So the consumer involvement is in large part the right thing to do, but from an engineering standpoint, it is absolutely the must to do if we're to truly tackle the information sharing and interoperability problem without disrupting privacy. And as the White House recently announced in its big data report, the whole movement of protecting patients' privacy in an era of big data has to move from notice and consent to authorizing use. And to me, that means bringing the internet privacy and permissioning ecosystem into healthcare. And I look forward to that happening on a faster pace, thanks to initiatives like Blue Button.
Roger, I'm curious, from having had exposure to other federal agencies and the VA work with Blue Button and the consumer, what were the concerns that, how did you guys address consumer engagement, but also the privacy and security aspects?
So the great thing about Blue Button is, go back to that statement, it is the consumer's data. And really, the whole theme was we are freeing that data, for the consumer to look at. They do accept responsibility for security of their data when it comes off of the system that retains it. And they're going to click a button that says, yes, I understand that. I'm taking my own medical information. When it's downloaded onto my desktop computer or my unit, I know I'm now responsible for that. And to some extent, as we talked to people that were building apps that were going to use the Blue Button data, we made it clear to them that we expected a certain level of security there. But on the other side of that, as you free that data and you look for innovation, you've got to recognize that that consumers understand that they are that they're holding their own information. They're doing things with that. They do it with their financial information. They do it with lots of other things. And I think our focus was on making certain that we communicated that we were doing all the protections necessary, for example, let's say secure download, those sort of things. But in the end, the goal is freeing that data and getting those app developers, getting people to really do something with that data, making it a simple enough standard that anybody can implement it. We certainly, by the way, being the government, we could have made it so complex nobody would want to implement it. I think it's an incredible testament of how simple it is that that so many organizations have stood it up so very quickly with all sorts of different data formats going into it, but the download then being available with just a simple click on that blue button from their website. So it's a great example of the implementation of the KISS principle. Instead of overthinking everything that might happen in here, get the basics right and turn it loose. And it's just amazing how innovative that has turned out to be. And I'll be the first one to tell you, we don't know where it's going now. I think Peter Levin would tell you he doesn't know where it's going now, and that's exactly what we intended.
Here's the interesting point for me to the end of the last segment, where you referenced the fact that patient matching is an investment that HIMSS is making in partnership with ONC. And I think about this in the context of with or without the patient's participation. Patient matching behind the scenes will have some error rate. Maybe we cut the error rate in half. Maybe we're really clever and we cut it by 90%. But there is still an error rate. And God forbid that it's your grandmother who suffers because that error rate happened to be for her records. Flip it around. What if they're involved? So I sign up with an accountable care organization, and on the first day, a caregiver, or I should say a care manager, asks me, oh, Anish, where do you typically shop for your pharmacy? Oh, I go to Walgreens. Oh, great. Do you have a username and password? Can we link your account into our profile? Sure. Oh, by the way, who's your insurance carrier? Oh, I've got Blue Cross Blue Shield. Oh, do you have a username and password? Do you mind if we link your account? Sure. Oh, by the way, You wouldn't happen to have a wearable device, would you? Oh, yes, of course. I've got a Fitbit. Oh, well, do you have a username and password there? Well, yeah, sure. Here it is. Patient matching, when I'm helping to link the accounts as part of my routine conversation with the provider, doesn't require a PhD in physics. It requires a PhD in asking and earning the trust that they're willing to share that information back with you. So it's interesting to say whether or not you're doing a patient matching strategy without me or with me. And I would bet a guess, if we were to put those two strategies side by side, with me will beat without me every day of the week.
We're coming up with about 3 minutes left to our segment. So we're in the midst of graduation season, and 22 years ago, a young Tom Leary was sitting at graduation at Rutgers, and he was contemplating life and life after Rutgers. What, with respect to what is your message to the young Tom Learys or anybody else on how do they engage in their healthcare and health IT?
I would say what my successor as White House CTO and I had been saying for quite some time. There has never been a better time than right now to be an innovator in healthcare. That this is the decade we will find a way to solve these challenges. That the combination of opening up of data that held in the public domain and even the opening up of private data through initiatives like Blue Button, in combination with the increased digitization of healthcare IT through the adoption of meaningful use in the programs, and finally the new payment models that are emerging that create the business case for building out the technologies where the productivity gains are about improving the outcomes for the American people, that in combination, all of these factors are going to give us a decade of remarkable change and incredible excitement. And whether that young Tom Leary is simply an entrepreneur looking to have lower healthcare costs for his business because he's going into some kind of social media app, well, God bless, because this is a decade that'll make that cheaper for him, or whether it's Tom Leary's sister who says, I want to fix this industry and I want to make sure that we can actually lower costs and improve outcomes. I want to play a role. This is the decade for their participation.
Excellent.
You know, a decade ago, people that really wanted to change outcomes for mankind went into things like cancer research, all sorts of medical pieces. And I would tell you that today, that kind of change can be driven by people going into health IT. You know, the next big breakthroughs are going to come through as a combination of the science and the information helping guide where the opportunities are, and the science then honing directly into how do we make that happen. And so there is an opportunity today for folks that care a lot about the nexus of those two things to help drive the cure for cancer, the cure for all sorts of diseases. Everything that mankind is looking for is, health IT has to be part of that.
Excellent. Well, thank you. And that concludes our discussion today on advancing healthcare transformation with health IT. Ensuring value for patients and the nation, sponsored by HIMSS on 1500 AM Federal News Radio. I'd like to thank our wonderful panelists, Roger Baker and Anish Chopra, for this fantastic hour, and we'll be continuing this conversation at next month's Government Health IT Conference and Exhibition in Washington, D.C. on June 17th and 18th. Key topics to be discussed include meaningful use initiatives, care coordination, the alignment of clinical measure reporting across all federal quality programs to reduce costs. Also, adoption of healthcare information exchange standards and guidelines to improve interoperability, and developing a consistent patient data matching strategy to improve patient safety. Look for sessions 2 on the critical financial, technical, and administrative topics the healthcare industry is facing. Attendance at the Government Health IT Conference and Exhibition is free for government employees. Visit www.hims.org/governmenthealthit for details on speakers and sessions. Thank you for listening. If you missed anything, this panel will be available on demand at federalnewsradio.com as well as hims.org/govhealthit.